Hi, I'm Jessica, and this is my audience. Hi, I'm Summer.
Hi, I'm Summer. Hi, I'm Kaden.
Hey, I'm Jen. We need to be quiet. Hard to keep them quiet. Okay, so today I'm going to do my informative speech on B-cell malt lymphoma, and I chose this topic in particular because I recently just got diagnosed with it in my right eye. B-cell malt lymphoma is a form of cancer and part of the non-Hodgkin's lymphoma family. MALT stands for mucosa-associated lymphoid tissue. Mucous membranes line many of your organs in your body and contain lymphoid tissue, which is part of the lymphatic system. The lymphatic system contains lymphocytes, or also known as your white blood cells, that help fight off infection and even cancer. In malt lymphoma, one type of blood cell, the B cell, increases and multiplies uncontrollably, and that can cause a tumor. In my case, it did it in my eye. This often affects the stomach, but can affect any mucosal membrane in your body. So it can do your eye, your stomach, your breast, your lung, a lot of other places, I guess. According to NoCancer.com, malt lymphoma affects slightly more women than men, and at an average age of about 65 years old. According to Macmillan.org, the signs and symptoms of malt lymphoma are normally specific to the organ that it involves. So if it's in your gastric area, then you should look for heartburn, nausea, and indigestion. Lungs would be weight loss, unexplained weight loss, fever, and cough. The breast is a painless lump. And then where I have it in my eye, there's tumor growth, and normally it's sensitivity to light. You should also pay close attention to enlarged lymph nodes, so in your neck, under your arms, in your breast, and unexplained weight loss, and also moderate to severe fatigue. If you're tired for no reason, and there's like you went to bed, you got enough sleep, and you haven't really done anything, and you're just constantly exhausted, that's a good sign of it, but it doesn't necessarily mean that it's lymphoma. Just something to talk to your doctor about. It could be, hormone levels are low, blood sugar's low. There's a bunch of different reasons, but it is something to keep your eye out for and talk to your doctor about if it persists or worsens and it doesn't go away after about a week or two. Treatments for this type of cancer are radiation, chemotherapy, and a drug called Rituxan. It's a medicine that destroys B cells by binding to a protein that's specifically expressed on the surface of these cells. Your treatment is based on where your malt is, if it has spread, and if it's responded to your radiation or not. If it hasn't responded to radiation, the next step is normally chemotherapy or the Rituxan. According to NoCancer.com, about 70% of people with non-gastric malt lymphoma survive for more than 10 years. The probability of recurrence on any malt lymphoma is about 40%. It's kind of high, but the good news is that most forms of this, it's a slow-growing malt lymphoma, and it's easily treatable. And if you do have a recurrence, it's, again, easily treatable, and it's not really, most times it doesn't show up in serious areas. Of course, it is a form of cancer, so it is still serious. Anyway, so I noticed I had a tissue growth on my eye in the corner, and it's part of the conjunctiva, which is the tissue that lines your eyeball, or the globe is what they call it. They call the structure that your eye is in the orbit, and then your eyeball is called the globe. The conjunctiva or conjunctiva is what is the tissue that surrounds your eye. In my case, the B cells migrated to the conjunctiva lining and caused a tumor growth. And I started noticing it grow onto my eye, on the right eye, and it started spreading. And after doctor's appointments, they finally did a biopsy of it, and it came out malt lymphoma. Then I got a PET scan and a CAT scan. A PET scan is pretty much the same thing as a CAT scan, only they give you a radioactive sugar solution that they inject into your veins. They let it sit for an hour, and it will migrate, because all cells break down glucose. If the cells break down the glucose faster, then that means that it's a cancerous tumor. So my PET scan and my CAT scan came out good. It's only in my eye. And I have my bone marrow biopsy on the 1st and my mask fitting for radiation on the 10th. With the radiation, I'll lose my eyelashes on my right eye. If they have to go higher up, because mine does surround my entire eye, if they have to go up higher, I may lose my eyebrow. And my eye will get really red and inflamed and all kinds of grossness. So it's lots of fun, and it makes you really, really tired. So it's a bunch of fun stuff, I guess. However, again, I chose the topic because I had never heard of this type of cancer, and you definitely don't think that you can get cancer in your eye. I mean, you know that you probably can get cancer anywhere in your body, but your eye. And it's good to educate yourself on any form of cancer, especially the rarer types that you don't really hear about, like a B-cell malt lymphoma on your eye. You don't hear about that at all. I've never heard of it until me, actually. And don't worry when it does happen. It's a scary situation to have to go through, but it is very treatable, and it's more of a pain in the butt to go through to treat it than anything else. But once it's treated, it's treated. And yes, you can have a recurrence. 90% of the time, it doesn't come back in the same spot. It can come back elsewhere, or it could not come back. So, but it's always good to educate yourself on these types of things and know your body and be aware of any changes that your body is having. And don't be afraid to be persistent. My doctor said it was allergies for 4 months. I've been dealing with it for 6 months, and for 4 months they said it was allergies, and I kept going back saying it's not allergies, and finally, look, it's not allergies, it's cancer. So just know your body, be aware of everything. If something's not normal, tell your doctor. And if your doctor brushes it off or whatever, keep going back if the problem doesn't stop.